MaxiMyo actually started when we made a cosmetic piece of equipment that was to be used cosmetically, in other words, to make ladies thin and attractive. And it worked very well indeed. In fact, we've now sold them all over the world. And then we decided we were going to make a medical machine. And you can't put a piece of equipment like this on the market until it's been properly tested and approved. And we have now all the necessary approvals. To the best of our knowledge, we're the only machine, a muscle activator in the world that has got these medical approvals.
EMS stands for electromuscular stimulation, and what it does is it allows muscle that may for some reason not be able to exercise itself to be electrically stimulated so that the muscle contracts, and if the muscle contracts then it'll strengthen. Well, there are really three main categories, plus if you like an assorted group after that. The first category, as I mentioned before, are things like sports injuries to knees, sports injuries to shoulders, sports injuries to hips, and so on. The second category are patients, people, clients with lower back pain, and it's shown to be extremely effective. The MaxiMyo has been extremely effective in treating spasm, in treating pain, and allowing people to strengthen their posture and their back muscles. The third important category, and I know you're going to hear about this later on in the program, is a category of elderly ladies, principally elderly ladies, who suffer from urinary incontinence. And the MaxiMyo allows them to strengthen their pelvic floor and therefore cure, in many cases cure, their incontinence. The fourth group of patients who might benefit are an assortment of a wide variety of conditions which we at MaxiMyo are still learning about. They include things like patients who have been refused hip replacement because the orthopedic surgeon has viewed that their musculature is too weak to benefit from a hip replacement, and after a course of treatment with MaxiMyo we can strengthen their hip muscles so they will actually be able to benefit from hip replacement and walk. Other patients within that category are also people who suffer from swelling of their arm, a so-called condition called lymphedema, which may either come from breast cancer, the treatment of breast cancer, radiotherapy, or the actual condition itself. It can be a very distressing condition, and we're currently conducting trials to see whether the MaxiMyo can actually squeeze the fluid out of the arm and make it comfortable. And really there are another variety of other conditions which we're still learning about, and we're anxious to hear from you to tell us what it can be used for as well.
The benefits for the therapist is that the treatment times are reduced. It is reduced in two ways. First of all, they're only half-hour treatment sessions, which means that she can see more patients during the day. Secondly, from the perspective of the course of treatments, this is also reduced in half. For the client, this is of benefit because they're spending less time at the hospital. They've got more time to do other things in their daily lives. And it also means they're back to work quicker, which can also mean the benefits to the gig economy as a whole.
We use the nerve conductivity, not just stimulating the muscles directly. And I had a thought at that point as to whether by using nerve supplies we could stimulate the muscles of the pelvic floor without having to touch them directly with internal probes. The reason I was interested was because NICE had just issued their new guidance, and it mentions that there's about 1.5 million women affected by urinary incontinence in this country, and the cost to themselves and the NHS is estimated at about £700 million a year, £600 per individual client suffering. That does include the cost to themselves.
With the MaxiMyo, it means people with this sort of injury can very easily be treated, and they are treated much faster than they would with conventional medicine. And the result of that is they can get back to work quicker, which is obviously an advantage to the NHS, and it's an advantage to them and to everybody else round them.